We're going to spend the next 30 minutes focusing exclusively on the skin tech portfolio of the peels, pick up on some of the early principles that I mentioned this morning and that Dr. Maione has just discussed as well. During this session, we will also give you a very short preview into our soon-to-launch Benebelum 2 peel systems, and we'll just touch on those core ingredient technologies within that portfolio again in a little bit more detail as well. So the first peel system that we're going to see, Dr. Maione has shown us some beautiful results from the system already, is one of our hero TCA products within the Skin Tech Pharma portfolio. This is the Easy TCA Pain Control, which when it's mixed gives you the overall concentration of a 15% TCA formula with a low percentage of phenol at less than 4%. So this is a peel by protocol that would be done as a course of 3 to 4 peels, ideally 4 at a 7 to 8 weekly interval. And the addition of the phenol in this peel offers a number of advantages strictly for a Fitzpatrick type 1 to 4. The phenol has a better advantage in tackling skins that are pigmented, particularly if the melasma itself is deemed to be more superficial. This peel by protocol is able to penetrate to certainly the basal layer or the Gren zone if it's done as a weekly course of treatment, as I say, up to 3 to 4. But that said, it will improve photo-age skins, sort of roughness, coarse textures of skins, even active acne actually responds very well to this strength of TCA as well, comedonal skins particularly. And although we're going to see a sort of a demonstration of a face here, this is a peel system, and I can speak from personal experience. This is my staple treatment that I have almost as a resurfacing treatment for my neck and my chest, which I find I get brilliant comedonal improvements with. And I also find it very beneficial for oil control and early sun damage as well. So it's not something that we can think necessarily should just be thought about for the face, the neck. We can also use it on the back of the hands with very robust protocols behind this system as well from the Skin Tech Pharma group. So just to recap again on some of these core preparatory products, or certainly products that will be used once there is visible desquamation, which is intrinsic to this peel system. Remember, we're going to now talk about an ingredient which is a protein coagulating agent, so it selectively targets damaged keratinocytes within the epidermal layer, as I say, reaching down to the Gren zone or the basal layer at least. And in doing so, we see increased cell turnover, new collagen laying down as a result, and a better quality tissue as a result. But during that desquamation phase, there are 3 core products with an option 4, which we'll look at in a second, which are critical. Aclaronze, bleaching and blending really come into their own here. As Lorna mentioned, we are talking about 2 different products here. Ultimately, one has a selectively preferential tyrosinase inhibition property to it as the Aclaronze, and bleaching and blending also has very high antioxidant levels, but both serve well in preparing the skin, suppressing the melanin activity before the peel. The other product that we've yet to touch on, which is a very sophisticated type of sunscreen within the Skin Tech portfolio, is the Melablock SPF 50, which also comes in a 30 as well. This is a physical and a chemical SPF, which is highly antioxidant. It does contain some heat shock proteins within this product as well, which allow the protein-based structures to heal without getting damaged by the oxidation through the thermal injury through this peel. Because as I say, we're talking about TCA, which is considered more of a destructive ingredient. So the heat shock proteins are critical in terms of the use of this product being used on a daily basis once the desquamation starts with the skin, because it helps to suppress any risk of any post-inflammatory problems. So a very sophisticated product that's been on the market for a long time. Other products that we will use, certainly as part of the core TCA peel itself, and certainly in the days and the weeks after treatment, we have our cleansing foam here, which is pH 5, so it's a pH neutral foaming cleanser that's suitable for any type of skin. And the beauty of it is that it's suitable even for when the skin actually starts to visibly peel. So we don't see any modification to skin permeability. It's SLS free. It has a sodium lauryl oat sulfate core ingredient to it, a little bit of lactic acid and humectant ingredients. We also will touch on and talk about the place for our IP-Laze post-treatment cream. IP-Laze, again, is one of the hero products within the Skin Tech Pharma group. It is suitable for skin that has had some degree of thermal injury. We have many clients and customers also who use this in clinics where they're doing perhaps HIFU or treatments where the skin is undergoing some sort of thermal damage or injury, because again we have organic silicium, which is a core ingredient within RS, the heat shock proteins, and this is highly anti-inflammatory as well. Beeching blending and Meloblock SPF 50. So this ultimately, these 4 products can be considered part of the core regimen, whether we're talking about the pain control TCA or we have a classic formulation which is just the 15%, which can in fact be used on all Fitzpatrick skin types from 1 to 6 with adequate preparation. So we will now jump over to Dr. Goodarzian.
Hello, I'm going to be demonstrating a peel for a melasma patient. This is Beatriz. Beatriz is from Brazil. She's 40 years old and she suffers from a little bit of melasma. So when it comes to melasma patients, it's really important that we prepare the skin really well beforehand. So Beatriz has been using the blending and bleaching cream, and she's also been using some AHA-based cleansers and so on, with obviously her sunblock, the Meloblock Factor 50. It's really important with melasma cases that we give the skin enough time to be prepared. And I would say minimum 2 weeks, but ideally actually 3 to 4 weeks before the first peeling procedure. And the reason why we do that is because with TCA, very often we get rebound pigmentation if we are too aggressive. So rule number 1 is we prepare the skin with anti-pigmentation products and of course sunscreen. And rule number 2 is that when you're actually doing the peeling procedure itself, you're not too aggressive. So we're only going to go down to the basal layer, which is maximum 2 coats of our TCA. And we don't really want to go to medium depth. That's really important. So that's what I'm going to be demonstrating. And then after the procedure, I'll be going through the aftercare as well.
So each kit, as you can see, comes with all the components that you will need to pre-mix this peel. Dr. Goodarzian here is mixing up the core-based solution of TCA, which contains the phenol, which is a 15% concentration, with also the base solution as well, which contains 4 different AHAs, saponins to give the peel formulation and even distribution to the skin. So that overall, what we now have in this container here is a 15% mix that's suitable to use on the skin. Alongside that, we will apply a post-peel mask immediately onto the skin, and that gives anti-inflammatory benefits, but it does not stop the peel from working. 2 cleanses are recommended for this treatment. Of course, we remove the makeup. Ideally, we'd ask patients to come without the makeup on the skin, of course, but 2 cleanses are necessary to be sure that the skin surface is even and pH balanced. Marking the face out, as we can see here, we will mark out a line from the medial canthus all the way down to the jawline near the sort of the marionette region. Boundaries of the forehead are divided into 2, just laterally by the lateral canthus of the eye to the hairline, and across from the zygomatic portion of the orbital bone all the way down to the mandible.
We're going to be using cotton buds like this. We're going to take 2 cotton buds, hold them next to each other, so we have a wider contact surface. Please make sure that you don't hold this acid in front of the patient or above their eyes or above their head, because you don't want this to spill onto their face. Also make sure that they keep their eyes closed during the entire procedure. So I'm going to dip in my cotton buds, go around, and then go around the rim just to make sure that there's nothing dripping. And I'm going to start with this side of the forehead, and we're just going to go in circles, small circles, and moving gradually, applying the product all over the area. And then once you're at the end, you're going to turn the cotton buds around and go back again, same way that you came, but in the opposite direction. And that counts as 1 coat.
So sequentially, the face is marked in a very intentional way, because we have to allow time for this irreversible protein coagulating agent to pass through the skin. And when it does that, the skin will respond and tell us in a very clear way exactly where it is. For example, When we start to see the erythema in the skin, we can say for sure that that 15% concentration is in the upper third of the epidermis, so it's not near the basal layer yet. Once we get to redness with signs of pinpoint frosting, we know we're near the basal layer. Those frosting points and redness can then turn into clouds in a fairly sort of gradual way. It doesn't tend to happen in a sort of very staggered and well demarcated way. But once the clouds start to appear in focal areas, then it's safe to say whatever skin type we're treating, whatever area of the body, we know that we are actually at the Gren zone. So by protocol for this peel, that depth of skin ideally will be reached every 7 to 8 days as the full course of treatment. And as you can see here, it's very important with this particular skin type that we actually feather this solution down across the mandible so we don't run the risk of actually, any difference in skin tone, because the phenol has...
Start with our second coat. So when we do a second coat, we're not going to be using the small subdivisions. So we're just going to be doing one sort of sweep all over the forehead, one sweep over the cheeks, and then the nose, and then the perioral area. This area, for example, is a really good example of frosting dots. So you can just see tiny little white dots. So you really need to look closely to find them. And then you can also sometimes see frosting clouds. So you can see a frosting cloud here near the temple, a little bit over the cheeks, and also near the mouth corner. Okay, so this is the end of our peeling procedure. So the reason why I have stopped at frosting points and frosting clouds is that we know with frosting points the peel has gone to the basal layer, and when we see frosting clouds we know that the peel has actually penetrated just below the basal layer, which is called the Gren zone. And for someone with pigmentation like melasma, I would not want to go any deeper than that.
This post-peel mask that we mentioned briefly at the start is measured in a very specific quantity for 2 grams for the face. It contains anti-inflammatory ingredients and retinol palmitate. We have organic silicium, ceramides, vitamin E and so forth, and it needs to stay on the skin for 12 hours because at this point we have initially coagulated the most superficial layers of the skin, so the skin is very vulnerable to changes in temperature even, or any other topical ingredients that go on the skin at this point. So it's very important from Skin Tech protocol to stick to the precise quantity of post-peel mask. So it's not acceptable for patients to run off to the loo, as I will probably be tempted to do, and start slapping on a load of them.
So that's the end of the peeling procedure. So from an aftercare point of view, leave the post-peel mask on till tomorrow, and then tomorrow morning Beatrice can wash her face with just maybe lukewarm water and dab it dry with a clean towel. And from tomorrow she can use the eye place cream. I would use that twice a day, and in the morning overlay that with the Meloblock SPF 50. After probably 3, maybe 4 days, she will have recovered, so she can go back on the blending and bleaching cream twice a day with the Meloblock sunblock in the morning again. And she will be using that again, which is really the prep products, until she comes back for the next peel. So whenever you're doing these peels, you're going to be going through a cycle. So they will be preparing initially for a couple of weeks, then they'll have the first peel, they recover from that, they go back on the prep products, and then come back for the next peel, recover, and so on and so on. When you're doing this peel in, say, spring, summertime, you would really want to make sure that they carry on with the blending and bleaching cream and the Meloblock for a few months after the procedure. If they are going on holiday, I would say I would delay the procedure until they've been on holiday. Just give them the prep products to use. But if somebody has had a peel and they're going on holiday, say in a month or so, I would still encourage them to use the blending and bleaching cream with the Meloblock and really try and stay out of the sun with the face.
So thank you, Dr. Xavier. Expert that he is, long distance. So just to summarise again here, so to be clear, we were literally just talking about 2 treatments that this lady's had, and something else that Xavier had mentioned on sort of the extended version of this video, which will be available for you if you've already undertaken some of our Skin Tech training. We can certainly offer the full footage and the full extent of these videos to you, if that would be helpful for your learning going forward. But this lady has ultimately had 2 treatments, but actually commented to Xavier that she noticed such a significant improvement from the bleaching blending alone before she actually even had the peel. And again, the ideal would be that this lady would then maintain her skin in terms of the reduction in pigmentation with something like the bleach and blend, or even the Aclaronze longer term. So I think we could all agree it's a fantastic result. So, looking at Benevolum now in a little bit more detail. So, with where things are at the moment in terms of what Skin Tech are currently working at, as I say, this is still 2 treatment protocols and formulations which are being worked on at present. But we have 2 separate protocols and 2 separate peels. We have a Lum Peel Cosmo, which is an AHA formulated peel which has a small quantity of tranexamic acid in. And we also have a 15% TCA formulation as well, which has a very similar crossover ingredients, but naturally we are talking about ultimately achieving treatment depths, obviously with key points of difference here in terms of whether we're treating early photoaging or photoaging plus textural irregularities in the skin, or even melasma, for example. So to look at things in a little bit more detail, so the core ingredients in the Lum Peel Cosmo, as I mentioned, we have tranexamic acid, lactic, salicylic, citric and mandelic acid. This is suitable for the face, neck and décolletage. It's ideal for all Fitzpatrick skin types 1 to 6. The pH is 3.5. And the protocol as it stands at the moment indicates that this peel can be done once the skin has been acclimatized with some of the home care ingredients, again, which are very similar, and then may be repeated 1 month later if necessary. And we have a short video demonstration to show the application technique for this peel, which is very similar to what we've just seen for the TCA pain control. So what can be used in conjunction with this as part of this protocol is a tranexamic acid and vitis vinifera, which is a very highly antioxidant ingredient, actually across the whole facial region as well. So this means ultimately that although we're talking about an AHA blended peel with a pH of 3.5, that ultimately we can achieve, a significant increase in the depth of the product penetration here with this on-the-spot treatment solution as well. So the Lum Peel Cosmo pre-peel acclimatization would fall into these certain products here. The treatment foam here also contains a tranexamic acid. We have a small amount of glycolic acid and also some hydrolyzed pea protein, which acts as a very effective filtering ingredient and also helps with pigmented skins as well. We've got a stabilized Lumina vitamin C here serum at 18%, which also contains the blue light filter, which Dr. Gina was just talking about, the importance of that in reducing and treating pigmentation as well. We have 2 strengths of SPFs here, the Fulgora SPF 30 and 50, with, again, the tranexamic acid also containing blue light filter as well as a solar filter, which is designed to be used immediately after both peels. And we also have the Lumina vitamin A, which is the nighttime option, which contains a small quantity of the vitamin A, the retinol palmitate, also with blue light filter, and the stabilized ester of vitamin E, which is alpha tocopherol as well. In terms of the post-peel regimen, the product range is very small and compact, and it's exactly the same. So again, all of these ingredients here are suitable for use on skin that has been treated either with the localized needling device or just in fact with the topical ingredients. So we have a short demonstration here just to give you an outline of how we can use this product. So this is the Cosmo, okay? So this is the AHA without the TCA, which would be at the 15%. So we have an ideal candidate here. Ideally, this lady to me would have been suitable actually for even the TCA, but didn't want the visible desquamation. So the treatment foam, as we mentioned, contains the tranexamic acid, the glycolic and hydrolyzed pea protein. It is a foaming consistency, very similar to its partner product within the standard TCA protocols. She has come in makeup free, and we're just applying this now to make sure that the skin is well balanced, acclimatizing the skin obviously to the ingredients as well. She had been using that pre-treatment core regimen for 3 weeks, and actually again commented to us that she had started to see a very nice reduction already in the pigmentation in her skin. So we mark out the face in a similar manner for how we've just seen from how Dr. Xavier has shown us, medial canthus to labia mental and jawline, lateral canthus to hairline. We submerge 2 cotton buds, so we apply this peel in a very similar fashion to what we've just seen with the TCA formula. submerge the cotton buds. The product does not need to be dripping off the tip of these cotton buds. Both are applied flat to the skin in a circular motion, and we make sure we wipe off any residue. This is already pre-mixed as a formula, okay? So there's no preparation in terms of mixing different ingredients that needs to happen beforehand. And as you can see, the technique is actually very similar to what we've already seen with Dr. Xavier's demonstration. With this particular type of formulation, of course, we're not talking about TCA, so we don't expect to see any coagulating, even any sort of whitening or frosting points within the skin at all. It's reasonable to expect to see some degree of erythema and redness as endpoints with very mild discomfort, bearing in mind the pH of this peel, as we said, is actually 3.5, so it's generally very, very well tolerated, but nonetheless, we still apply the peel solution in a gradual manner around the face, section by section. Still, obviously, taking the cotton buds, as we can see here, all the way down to the jawline as well. This peel, as I said, if needed, can often be repeated at 4 weeks as well, if necessary. So once we've treated each areas equally, often just with one pass of product, we can apply the Fulgora, ideally the factor 50. I know it's available in 2 different concentrations, the 30 and the 50. 50 would be preferable post-treatment. As we said, it contains solar filters. We do have varying different sunscreen agents within it, the tranexamic acid as well. But as you can see here, there is some small amount of redness coming up. This lady has had stronger peels in the past and actually found this one by comparison extremely well tolerated. But you can note there's just some very mild redness just in around these areas here. It wasn't necessary actually to even use anything like an alcohol degreasing solution for this lady's skin because she'd been so well acclimatized already on the pre-treatment products. Redness localized, as you can see here, indicates that we have achieved our endpoints. We don't expect to see any protein coagulation, as I say. We're not looking for an intense level of erythema post-treatment either. This is an acceptable place to say we've achieved what we needed to achieve from this peel. Ultimately, it's an epidermal depth. So at this point, we would now apply our Fulgora. We'll have this ready. Areas that are particularly pigmented, we can then use the microneedling solution here, which contains the Vitis vinifera and the tranexamic acid. Now, the TCA protocol means that you can use this actually twice within the same protocol. So you can apply it locally in and around any areas of melasma, for example. But here we can see we can actually apply it across the whole area of the face as well to give an added penetration of both ingredients. Home care, as we said, we've got the Fulgora 50 here, broad spectrum factor 50, and we apply that, as you can see here, fairly generously. It was an extremely hot day, to be fair, when we did this peel. And bearing in mind this lady's skin barrier function has now been broken by the microneedling device, so we put a very generous application of this factor across the full face. Very similar home care to what we're talking about with the TCA formula that we've just seen with Dr. Xavier as well. So looking at the Benet Balloon stabilized hybrid TCA peel, this does still exist as a 15% formula, similar to the pain control equivalent that we've just seen, but we have the addition of the glycolic acid and the citric acid ingredient within this peel. It's pre-mixed, as I said, so you might remember seeing Dr. Xavier mixing a base solution with a carrier within the neat 50% TCA. We don't need to do anything like that. This is a pre-mixed TCA formula already, suitable for face and décolletage. And again, we can, with suitable preparation, as we've just seen, you can use this on all Fitzpatrick skin types, but respecting the pH of this product, which is 0.5. Again, this can be repeated a month later if necessary, but the befores and afters that I've shown you from the case study, we were very surprised to have seen the amount of reduction in pigment that we saw just from a single treatment. Again, you can use the spot remover solution in conjunction with this protocol as well, but it's used twice in the same treatment as opposed to just once with the Lume Peel Cosmo. Pre-peel preparation products are exactly the same, so we have the treatment foam, vitamin C serum, SPF 50 with vitamin A and E product at night time, and again, exactly the same products as what we've just seen with the Lume Peel Cosmo post-treatment as well. So this was an individual who has a very, very thick and textured skin condition. This is all sun damage. This lady has no sort of history of any hormonal contraceptives. We looked at the depth of the pigment under Wood's light, and it was appropriate to use this type of ingredient formulation with the needle in the spot remover solution. So bearing in mind this lady's only just had one peel and actually was prepped just for literally 2 weeks before treatment, we were very surprised and excited to see the reduction in all the browning across the medial cheek and the forehead. And she says she's had a number of compliments from her nearest and dearest since having this peel, which is particularly notable across the lateral zygomatic prominence here as well. So this was, to be fair, epidermal in depth, so we're not talking about treating a particularly stubborn case here, but nonetheless it's a very, very nice outcome just after a single peel, and we will go ahead and then repeat again to see what further reduction we can get from this level of pigmentation. She loves the home care product. She's going to stay on everything until we treat her again. So in terms of what we have coming to market hopefully very soon, it's a very exciting and novel treatment system. Home care products that are very promising. The in-treatment protocols seem to give a very, very good result. So again, we're talking about a pigmentation system here which also offers proven anti-aging benefits as well. The skin brightness and tone improves significantly alongside the actual pigmentation itself. Something just to pick up on again from what Lorna was mentioning with regard to our very esteemed colleague Dr Goodarzian, he is offering bespoke training at his Southampton clinic, and your business development managers will have dates which he has now released, which will start from this month in September. If anyone was interested in perhaps doing an update, he's offering peel training across our entire portfolio, and he has a phenomenal amount of expertise, for example, in our phenol strength formulations. So SkinTech do a lip and eye and a 30 and a 60% phenol peel. So we're very lucky to be able to have that level of expertise in the UK because that hasn't been possible. So if that's something that may be of interest to you, please do speak to your business development managers, because as I say, his expertise with this portfolio is second to none. So thank you very much.